Next up, I'm excited to introduce Dr. Jan Carney. Dr. Carney has been instrumental as a board member for Less Cancer, and also instrumental to her home state of Vermont, where she was formerly the head of public health for the state and is now with the University of Vermont's Medical School in public health. She is joined today by the Veronique Pittman speakers. We have two students that she'll be introducing you to. And please welcome Dr. Carney.
Hi, I'm Dr. Jan Carney, Associate Dean for Public Health and Health Policy at the Larner College of Medicine at the University of Vermont. I'm delighted to introduce two of our students from the class of 2023 to present some of their work at the 2021 National Cancer Prevention Day. First, I want to give you a little background about the project. This year, about 6 months into the pandemic, all of us knew that people were experiencing tremendous health and social needs. So we worked in partnership with United Ways throughout Vermont to develop an electronic survey and had more than 1,000 responses to gather perceptions of the people working in community agencies and living in Vermont communities about what were the biggest health and social needs 6 months into the pandemic. And what we found, unfortunately, was what we expected. People were experiencing substantive delays in access to health care. They were also having difficulty with food security, financial stress, and other barriers to good health. All of these things we know are essential for cancer prevention. Foods we eat, to make sure that people have access to resources to stop smoking, that they can have access to primary care. So what the students found was extremely important to improving the health of our community during this challenging time. Two of the presentations were especially important to preventing cancer. And I want to bring attention to these social needs or the social determinants of health that they highlight. Our first presentation is by Merriam, and it's evaluating the levels of financial stress across Vermont in the COVID-19 era. And the second presentation is from Julie Evans, who looks at the basic needs of transportation and childcare and how these can be barriers to good health and cancer prevention. I want to emphasize and give credit to the entire class of 2023 at the Larner College of Medicine. In each of these cases, these students are part of a group of students, and their group chose them to be the voice of the presentation. I hope that you enjoy them. And again, thank you for the opportunity to be part of the 2021 National Cancer Prevention.
Evaluating levels of financial stress across the state of Vermont in the COVID-19 era. The continuously evolving pandemic has reshaped the financial landscape across the U.S. A 2020 United Way Health Survey provided insight into the disproportionate financial stress experienced by rural Vermont populations when compared to urban Vermont populations during the COVID-19 era. Our poster highlights these differences in financial stress across the state and provides a review of programs across the nation that allow us to make specific recommendations for the state of Vermont. Results from the United Way survey indicate that rural counties display significantly greater levels of financial stress compared to urban counties. The only urban counties in Vermont are Chittenden, Franklin, and Grand Isle County. These are shown in Figure 4 as the lightest colored counties in the top left corner of the state. Responses to the financial stress questions were recorded on a 5-point Likert scale ranging from strongly disagree to neutral to strongly agree. The 3 statements addressing financial stress in our communities were as follows. Question 1. It is hard for people in my community to pay for the basics like food, housing, medical care, or heat. Question 2. People in my community need help finding or keeping work or a job. Question 3. People in my community need additional education or training to help with future employment. As we can see in Figure 4, the rural counties in Vermont had significantly greater positive responses, including agree and strongly agree, when asked to rate the above statements. In light of this demographic difference between urban and rural counties, our recommendations for the state of Vermont include creating and/or improving medical financial partnerships, which will reduce patient financial stress, increasing federal and other grant funding in rural hospital systems, screening for poverty and housing insecurity in primary care settings, and intervening for those with positive screens or those at risk, advocating for healthcare organizations to become involved in ending homelessness, housing insecurity, and working with government and private sector community organizations to eliminate these problems. Further investigating universal basic income. Thank you.
Our poster focused on the basic needs of communities in Vermont, specifically transportation and childcare. Transportation and childcare are vastly important to a wide range of people for reasons such as getting to healthcare appointments or being able to work. Vermont's aging population and mortality creates a unique challenge to providing adequate transportation. Every year, approximately 3.6 million Americans delay medical visits due to transportation barriers. Regarding childcare, 65% of parents' work schedules are impacted by lack of this resource. While transportation and childcare are problems for America as a whole, our project's purpose was to focus on highlighting the difficulties faced by our community in Vermont and how access to childcare and transportation can improve these communities. The survey was developed by the United Way of Vermont and the University of Vermont College of Medicine to explore people's perceptions of need. Eligible participants were over 18 and self-identified as residents of Vermont. The survey questions use a Likert scale of strongly agree to strongly disagree. For both graphs, red refers to strongly disagree, blue refers to strongly agree, and purple is neutral. Our top graph focuses on the survey question of whether there is a lack of transportation in the community. The data showed a significant correlation between the perception of low access to transportation in female respondents, receiving social services, receiving low access to childcare, and living in a rural community. Our bottom graph focuses on the survey question of whether lack of childcare makes it difficult for people to work or study. The data showed a significant association between perception of low access to childcare in young adults, having children under 18, and a lower education level. Previous studies have shown that rurality is associated with lack of access to childcare and transportation. This is consistent with our data. The significant association found between lack of childcare and transportation demonstrates a potential double burden on the members of our community. Possible recommendations we propose are temporary solutions to relieve this burden while waiting for the change to the infrastructure of the community. A rideshare program provided by Medicaid to help get patients to appointments was done in Philadelphia and worked well. We recommend it to be tried in Vermont. We also recommend advocacy for those within 200% of the poverty line to be guaranteed financial coverage for childcare needs.